are united in diversity. We are very heterogeneous in our opinion.
We are doing this in our open democracies. Discussion is all open and loud, and I'm not for that.
What is European Union? What is freedom? How we learn together.
The obvious question is, what is the EU doing? What is our plan?
Welcome back. Hope you enjoyed lunch. That was like an actually nutritious, healthy lunch at a health event. So nice job, whoever did the catering. Thanks to all of you for coming back, for joining us. If you're just now joining us, I'm Sarah Wheaton, your MC for this special 10th Healthcare Summit. I'm also Politico's Food and Agriculture editor and the host of the EU Confidential podcast. Hope you've had a chance to stretch and recharge, maybe share your hot takes from this morning, because we're just getting started. This afternoon, we're shifting gears from innovation to preparation. Of course, not mutually exclusive, but still, just a slight shift in focus. After all, the next crisis won't wait for us to be ready. And so with that, now let me please welcome Helen Collis, Politico's healthcare editor and my co-MC.
I am already here.
Oh, you're here. Okay. Sorry. Very focused on you. All right. Well, Helen, what are we looking at this afternoon?
Thank you, Sarah. So this morning was all about revitalizing and spurring and supporting the innovation in Europe from the early research phase through to regulation and to market access, and trying to balance that difficult situation of supporting industry and providing access to patients as well. Like you just said, we're going to pivot this afternoon towards health security, grappling with chronic diseases, and how to pay for many of these healthcare challenges. Shortly, we're going to be hearing from the Preparedness Commissioner, Hadia Labib, who is with us already. We're then going to dive into health resiliency and being prepared, and how being prepared can help to deal with economic, climate, security shocks from a healthcare perspective. We're also going to look at how Europe is managing with these growing rates of non-communicable diseases, such as cancer, cardiovascular disease, and many others, as well as examine some of these leaked EU plans to deal with them, which include, we understand, putting up taxes on unhealthy foods. And we'll be bringing our newsroom guru to talk to us about the money side of things. So Gregorio Sorgi is going to come from the newsroom in Brussels to help us understand this afternoon how EU health policies will be funded in the next multi-annual financial package. So we'll be looking forward to hearing from him then.
Okay, yeah, really, really leveraging Politico's whole newsroom, capturing this health in all policies approach. If you're still digesting, literally or mentally, I promise you this afternoon's discussions will give you plenty more food for thought. Before we begin, a thank you to our leading partners, AstraZeneca, Haleon, MedTech Europe, and Sanofi, and to presenting partners, FPA, Johnson & Johnson, Lilly, and Sandoz. Huge thanks to you. And now I'll hand it over to Shannon Resetich, Head of Key Markets for Specialty Care at Sanofi, for a short intro. Then we'll hear, as Helen said, from Commissioner Labib, and I'll be back after that. Thank you.
Good afternoon. Welcome back from lunch. On behalf of Sanofi, I want to thank Politico for convening us around the most critical challenges facing Europe today. Let's begin with a bit of imagination. I'd like us all to imagine something. A Europe where every significant scientific breakthrough translates into health and security for our people. Where resilience isn't just a concept, it is the foundation that protects us. And something tells me if I had a show of hands moment like Sarah did earlier as to how many people in the room believe that that could be a reality by 2030, there would probably be the same number of hands raised in the room as earlier. But to me, this is an inspiring vision. Why is that? Because behind every innovation, there are real people. A mother managing her child's asthma, a grandfather living with COPD, families who have experienced RSV and the flu. They are the reason this work matters, and they are counting on us to move from ambition to action. When we harness the full power of the life science sector, we can build a stronger, healthier, and more competitive Europe. From geopolitical shocks to rising respiratory and infectious threats, the past few years have shown us that health security is the foundation of economic growth. In just 20 weeks, one virus, COVID-19, reduced the European Union's GDP by 16%. Chronic respiratory diseases like asthma and COPD are the third leading cause of death worldwide. Every hour, 425 people die from COPD. In Europe, COPD consumes 6% of EU healthcare spending, and the societal cost exceeds 1.1 trillion euros. But here's the opportunity. Every euro invested in preventative healthcare returns 14 euros. And over the last 50 years, immunization has saved 154 million lives. That is 6 lives every minute. We're talking about reinforcing preparedness, embedding prevention into every layer of health policy, and securing access to treatment during the immune science revolution that we are living through for the people who are counting on us. First is preparedness. Preparedness is a living commitment to protect lives, which means we must anticipate the unexpected. That could be a pandemic, respiratory threats driven by climate change, or emerging infectious diseases we have not yet encountered. Europe has made progress with HERA, but we must continue to invest decisively in science that will be key to confronting future health risks. At our company, 75% of our assets are based on understanding and modulating the human immune system, targeting diseases worsened by climate change and respiratory threats. This is by design. We are committed to improving our understanding of the immune system to enable us to bring forward breakthrough medicines and vaccines that help prevent or change the course of chronic and infectious diseases. Second, prevention and management of NCDs, the foundation of health security and economic growth. Prevention is not a cost. We know from the numbers that it is the smartest investment that we can make. Prevention is effective. Respiratory vaccination, such as flu vaccination, is associated with a 34% lower risk of major adverse CVD events. But it's not just about preventing disease. It's also about managing non-communicable diseases before they become irreversible. NCDs account for 7 out of 10 deaths globally, and respiratory conditions are among the most severe. The inclusion of chronic respiratory diseases, asthma and COPD, in the political declaration of the 4th high-level meeting of the General Assembly on NCDs and mental health, together with the WHO Integrated Lung Health Resolution, marks an unprecedented policy milestone. But it will remain symbolic without action. Doing nothing for NCDs means more preventable deaths, poorer outcomes, and rising costs. We cannot wait for another decade. As Sarah was saying earlier several times, quoting the speaker before, we have no time to lose. Third is investing in resilience. Resilience does come at a cost, but that cost must be seen as an investment in Europe's future. The MFF offers an opportunity to embed health, and more particularly health security and prevention, into long-term planning. Investing in health is investing in Europe's economic security. So what can we do today here in this room? First, we need governments and industry to continue to work together to strengthen preparedness frameworks, ensure we can rapidly deploy medical countermeasures when they're needed, and ensure regulatory flexibility for AI-based clinical trials and increased EU funding. Second, prevention needs to move from aspiration to implementation with clear targets, such as cardiovascular and lung health checks and monitoring of high-risk patients. And third, investment must be secured and protected. To make the EU competitive, we need to double public budgets for innovative pharmaceuticals in the coming 5 years. This work will require all of us. It won't be easy, it won't be quick, but Europe can lead, not just in science, but in delivering health for us all. Thank you.